Every 19 seconds, someone dies from a disease that could have been prevented by a vaccine. In northern Nigeria, vaccine-preventable diseases such as measles and polio are common but hardly surprising. The region has a long history of resisting child immunization due to ignorance and little or zero faith in vaccines. Limited access to healthcare and widening poverty gaps that force caregivers to prioritize daily work for survival over time off for vaccination make immunizing children challenging. But since 2014, a simple initiative has been making a profound impact, turning caregivers from vaccine apathy to vaccine acceptance. This initiative is the promise of cash for vaccines at selected public clinics in 9 out of the North's 19 states. The initiative is driven by new incentives, All Babies Are Equal, a US-based non-profit that rewards people from poor communities for making improvements on their health and other critical aspects of life.
So New Incentive is an international organization that is having a partnership with state and local government authorities. And what it does is they try to see how they can improve routine immunization rates, covering all the children that are due for vaccination by giving small cash incentives to the caregivers that brought in their children for immunization.
The initiative provides a cash incentive of 1,000 naira per routine immunization visit up to the 6th visit, with an additional 5,000 naira upon completion of all visits.
Na zo yin immunization ana ba mu kudi haka in mun yi immunization in an mana allura in an gama za a ba mu 1,000 in kuma mutum ya gama complete mu mun dawo ranar ƙarshe ne za a ba mu 1,000 kuma kara mana 5,000 6,000 kenan.
The initiative addresses more than just poverty, it builds trust in vaccines. Many caregivers say the cash transfer motivates them to complete routine immunization visits to health centers.
Gaskiya na ji daɗin abu. A ranar ma ni ranar da aka ce za a ba da 5,000 shi ma ni ban san da shi ba. Daman ba a mana wannan na shekara ba na ɗiga wannan. Ha mun yi wata na 15 kuma ba mu samu wannan na ɗiga na 15 na wata ɗaya na shekarar nan ba. To dalilin abin da ya dawo da ni kenan. Yanzu a mana ɗiga na shekarar nan. To da na da cike yanzu yanzu daga na koma ma tukunna mu samu abin da za mu sa a cikin mamu da yaya yanzu ma hakan nan ba tukun to ban na bar yaya na wallahi ni ma haka ko karyawa ba wallahi tallahi ko karyawa kuma yayan ma haka na basu wallahi ba tukun to baka tona wa kanka asiri ka san shi namiji dan salarin kuma kaga ba yanda yake ba isan mu yake ba wallahi ana wani hali har ga Allah dan gaskiya kun taimako mi shi yasa ma kaga tun 5:30 na taho an idar da sallah kenan na tafi na tsayi da ka zo ka samu inda za ka yi.
Muna yin wannan muna tafiya da shi haka mu hau mota mu zo mu hau mashin mu koma kuma mukan siya wa baby abin da zai gyara masa ciki. Ina da yara 3 dukansu na musu complete rigakafi kowanne tun ba a bamu kuɗi mu dama muna yin rigakafi ko muka zo ana bamu kuɗin ya karfafa mana gwiwan zuwa rigakafi kuma dukan zuwa rigakafin mu wannan karan ana bamu kuɗi kuma muna karba cikin jin daɗi yana taimakon mu da yawa saboda ka san yanzu kuɗi yayi wuya a hannun mutane wannan kuɗin da ake bamu yana taimakon mu sosai ma muna ba da shawari wa mutane akan wanda ba sa yin rigakafi su kawo yaransu a musu saboda rigakafin nan ko da a baka kuɗi ko ba za a baka kuɗi ba yana da amfani ga yaranmu inda su yi zazzabin su shattuwa su wannan dai in yaro an masa complete rigakafi yana zuwa masa da sauki to wannan rigakafin kaga ya taimaka ta wannan fannin.
Until the introduction of the initiative, vaccination halls were nearly empty.
Look at our number now. Look at our population. People are coming on and on. For example, there are some women that they don't used to come for immunization, but because of this money that they are giving us, sometimes they don't like the immunization, but because of this money that they are giving, 1,000, they take, if they come, they use that money to go back to their home for transport. I don't want to forget the next date of immunization.
New incentives, All Babies Are Equal, have enrolled 3.9 million children, encouraged 55 million vaccinations, and disbursed 16 billion naira across 6,368 government-owned clinics. One critical part of the program's success is the collaboration with state governments that operate the selected health centers.
We collaborate in the areas of planning meetings, planning field activities. We collaborate in the areas of data sharing, and we also collaborate in other aspects such as capacity building of our healthcare providers. We've recorded huge successes. I can tell you that we have seen an increase in demand for immunization across all our primary healthcare facilities, and this we have measured through admin data like DHIS, and then as well as community surveys that have been conducted, and also feedback from the community as well as from the healthcare facilities. So we have high infant mortality, under-5 mortality, and that is majorly as a result of low immunization coverage. But I assure you now that we have seen an improvement in our coverage of immunization coverage rates across different antigens. I'm very confident that very soon we will see a drastic decline in under-5 mortality and morbidity in Gombe State.
Emergence or the presence of the new incentive in the state also helps in terms of the improvement in acceptance or increase in the number of parents to come for routine immunization, bringing their child to their health facility because of the supported transport given to them. For me, it really increased in terms of the enrollment, because many children who have not received routine immunization are coming out to receive vaccination based on that. If not, I can say if not, it even doubled the number of the children receiving vaccination when the new incentive are with us. There is really a lot of improvement in terms of turnout to receive routine immunization by every nook and corner of the state.
However, despite new incentives, awareness campaigns in partnership with community and religious leaders on the essence of vaccination, there is still lingering skepticism. Notwithstanding, a region that once had the majority of its people opposing vaccines is gradually embracing them to secure the health of families and communities, and the new incentives initiative remains a strong part of that positive change. With each cash reward, a family is empowered, a community grows stronger, and a child's life is potentially saved.